Another question from one of our readers. When can I exercise after ACL surgery? It's a very common question and something that we do go over with patients who have an ACL injury and are looking forward to an ACL reconstruction. However, most of the information about what you are allowed to do after surgery takes a back seat to your concerns prior to surgery. So this is an understandable issue that arises every single day in the office with the unfortunate many who have suffered an ACL tear. Now, return to activity is subjective. You can return to various activities at various points during the recovery process. So as soon as you have the leg strength back and your motion back, we allow for walking, assuming, of course, you did not have a meniscus repair that needs to be protected, and thus you need to remain on crutches for a few weeks. Otherwise, the new ACL is not stressed by simple walking. We also allow bicycling early on in the recovery process to encourage return of range of motion, to get your muscles working, and to begin to work on your muscle strength. You will notice a significant amount of atrophy or thinning occurring in your quadriceps muscle after surgery, and the sooner you start active exercises, the less the atrophy will stay around. Now, the next set of exercises that are typically allowed is running. Many people focus on running, but it's probably the one activity you should focus the least amount on. It turns out that the chemical changes of inflammation stay in the knee for upwards of a year following an ACL reconstruction. So pounding on the knee is probably not the best activity that you should look into doing following an ACL reconstruction. The literature over the last few years has really shown that we might be going a little fast with certain activities, such as running following an ACL reconstruction, yet we're going too slow on other activities, such as muscle activation. So it's very important that you work with your athletic trainer, your physical therapist, and you have many open discussions with your surgeon at each visit about what the next phase of your recovery allows for, what your expectations are, what your goals are, and the activities that you are allowed to do are. We tend not to allow any cutting, turning, pivoting, or twisting activities to be done on your own until we know that the strength of your leg is returned, your form is correct, and you possess the appropriate agility skills and qualities that allow you to perform these activities safely on your own. Until you hear from your physical therapist or athletic trainer, you should be doing those exercises only under their supervision. Now, the recovery from an ACL reconstruction is easily an 8 to 12 month process. Don't rush it. You do not heal faster than others. Start your walking early. Start the return of motion early to minimize the atrophy and weakness that's going to occur in your quadriceps. Don't start too quickly, because if you do have significant weakness, that knee could buckle under you and you will suffer a re-injury, and you have to start the whole process once again. Do not return to sports or activities involving cutting, pivoting, turning, and twisting until you're given the okay to do so. Don't rush this. You've committed to a long-term process. This is far more of a marathon than a sprint. Give it the time it needs to recover. Give your knee time for the inflammation cascade to diminish. Again, that can take well over a year. And hopefully you'll have a well-functioning knee that is stable and allows you to return to certain activities, and you're happy with your result. Take care.